So let's start. This is the second session, and today we are going to cover RCM cycle. Long form is revenue cycle management, and all these are the departments where you are going to work in any company. Most of the departments are handled by the single company only. Very few times it is outsourced to other companies or some departments like coding and refund department. It is at client side itself. They are creating internally a billing team, and because those are the sensitive part, so sometimes they are not outsourcing all the departments to other companies. Okay, so one by one we'll go. First is the patient appointment. So nowadays we also know that if you are going to the specialist or the hospital, first of all we have to book the appointment. Okay, and then only you can go and take the service if it is not uh, serious, or the if it is not emergency. For the emergency cases, definitely you can directly go without taking any appointment. In US also the same thing. First of all, patient have to take the appointment, and then only patient can go on the given time schedule. So multiple ways are there to take the appointment, like depend on the hospital how many ways are there to book the appointment. Some hospital is having their dedicated application or the website, uh, and by calling also patient can book the appointment directly. They can go and take the appointment. Okay, so these three four ways are there to take the appointment, and there is a dedicated person, or the if the hospital is big, then a dedicated team will be there to book the appointment on the basis of doctor availability. Patient will get the dedicated uh, time period, and within that time only patient have to come and take the service. Okay, so whoever is handling patient appointment, every nowadays everyone is using some software to manage their hospital, right? This practice management software, under the single software all the departments can use, and according to their roles and responsibility they are getting access to the particular screens, and accordingly they are adding their part. Okay, one second guys, someone is trying to join. I'll add him. Okay, so we were discussing about the patient appointment under the RCM cycle, and this is the first department. And whoever is handling patient appointment department, uh, those people are getting calls or online requests for uh, taking appointment, and everybody is using the single software. All these departments are using the single software, the practice management software, and first of all this person, example, only single person is handling that for small hospital, and this person will check that patient record is there in our software or not. For every patient a single account will be created, and in future if patient is coming again and again, the same account will use. They are not going to create again and again new accounts for the same patient. Okay, so under the same account the new visits will be there. If the patient is existing, like uh, we have the history for the patient, and we already have created one account in our software, so that time we are just creating a visit. That means the date of service, and the for which doctor the patient is taking appointment, and all those details will be added by this person. And also if he is creating a new account for new patient, so that time he will take all the details from the patient, like patient name, his address, phone number, policy details, how many insurances he is having. Okay, those details are called as demographic information. Whatever patient or the policy holder details, if we are taking from the patient and entering into the softwares, those details are called as demographic information. Okay, so anyhow in coming sessions again we'll discuss these things again and again. Okay, so don't worry. So this person work is done. He has entered all the details, and he has given a slot to that patient according to the doctor's availability, and he has also entered all the insurance information. if patient is having two three insurances, he will scan all the insurance id cards and he will enter into the software. Okay, that's it, his task is done. Now next is patient came to our hospital uh, on given time, and before taking service there is another department, that is the eligibility and benefits verification department. Okay, so after this training you can apply for this department as well. So eligibility and benefits verification department is having two tasks. One is to check the eligibility, that means policy is active on the date of service or not, from which date it is active, when it is going to terminated, those details they are taking and entering into the application. Second part is benefit verification, that means what kind of services or the benefit it is giving. If it is a dental plan, obviously it will cover only dental related service. Okay, like this according to the policy they will take all those details. Maybe they can check on the insurance web portal about the eligibility and benefits, or they can call and reach to the eligibility and benefits department, and they can take all the details and enter into our application. Okay, they have one more task. If the if the hospital is small or only the one or two doctors are there, so they have one more task, that is need to check whether the authorization is required or not. So what is meant by authorization? It's a kind of permission. So for some services, according to the insurance plan, there is a need to take permission from patient's insurance company. So that taking permission to provide that service to the patient is called as taking authorization. So this team is also responsible to take the authorization, and sometime hospital is big, so many doctors are there, so there is a dedicated department for the authorization, also called as pre-authorization department. So their task is same, they are directly contacting to the insurance and reaching to the authorization department, they are confirming whether that for that service needed authorization or not. If authorization department confirm that yes there is need to take the authorization, so every insurance company is having different ways to get a authorization. For some companies, some insurance company, we have to fill some form and then we will get the authorization. For some insurance company we can get a authorization on call itself. Okay, for some insurance company we have to upload or we have to fill some information on their website, and then we will get the authorization information. So what is meant by authorization and all those things will cover or will discuss again in detail. At this point, just remember the second department is eligibility and benefits verification team. They are just checking whether the plan is active or not and what kind of services it is covering. And third is they are reaching to the authorization department and checking whether there is a need to take authorization or not. Okay. Now next is the medical transcription. Nowadays, from last 10 years, this department or this job is vanished from the market because there is no need nowadays. So what is meant by transcription? 10 year back, what doctors used to do while providing service to the patient, they used to record their voice, how the patient is responding, what kind of service they are providing to the patient, everything they used to record. And those recordings coming to this department, and this department people are listening those recordings and converting into the written document called as medical record. But nowadays we know that so many applications are there in the mobile, even though we are talking, then also automatically it will get typed, right? So automatic documents will get created. So that's the reason nobody is giving any work or nobody is needed nowadays for the medical transcription. Just for our information, we should know what is meant by medical transcription. Okay, someone can ask you in an interview. So consider that while providing service, medical record is already generated. Okay, so medical records in US, everywhere they are creating in very detail. Okay, like in India also, if our family member or any friend is admitted into the hospital for 1 week, 2 week, for any reason, we know that they used to create one file, and all the documents will be there, like the prescription records are there, pathology reports are there, some CT scan or MRI or any X-ray, everything. All the documents will be there in the single file. So the same thing will be there in US, but it is in more detail. Okay, so those 50 to 60 pages will be there under the medical record if the patient is in hospital for 1 week, example. So we cannot send 50 to 60 pages every time to insurance company to get the payment, right? And insurance company also don't have that much time to read those medical records and decide how much payment they have to pay. Okay, so that's the reason our next department responsibility is to convert those medical record into some codes. So that is the next department is the medical coding department. So medical coding is very vast thing. If somebody want a job or want to enter into the medical coding, all minimum 6 month course will be there, and they have to do a certification as well. After that only they can get a job. And as per the specialty, so many specialties are there for the doctor. So as per the specialty, they have to select for which specialty they want to learn, and then only they can uh, do the course and do the certification. Okay, and after that they can apply only for that specialty doctor. Okay, 3 lakh plus course are there, so it's not possible. And so many application softwares are there, they are using, they are entering the description about the service and they are getting the course. Okay, and they are entering into the software. Okay, so those codes whenever they are entering codes into the into our application, okay, those codes are going on the claim form. When we are billing our claim form to insurance, entered code by coding team will go on the claim form. Okay, so we'll see that in some time, actually what kind of codes they are entering and in which blocks it is going. Okay, in 2 3 minutes we'll say. So medical coding part is done. They have entered procedure codes, modifiers, diagnosis code, okay, NDC codes, whatever required from their side, they have entered on the basis of medical record. So in medical record also, so many pages are there. So from that they are going through each and every page, and then only they are entering those codes into the system. Okay, now next department is the charge entry and billing team. So on the basis of codes entered by coding team, they are entering the charges. Okay, many applications are there nowadays. Automatically charges are getting populated into the software. But in some software which are very old from last 10, 15, 20 years they are using and it is not updated. So charge entry team is needed to enter the charges for that service. Okay, and they are only deciding uh, to which insurance needs to be bill our claim. Okay, so if patient is having 2 3 insurances, so our bill charge entry and billing team will decide where we have to send on the basis of priority, which insurance is the primary, which insurance is the secondary. So accordingly they are billing, and how that insurance is accepting the claim, whether that insurance is accepting electronically paper. Okay, accordingly they used to bill the claim. The most preferred way is the electronic way, and they are billing through electronically. Okay, so they are only doing the claim submission. Now next part is the claim rejection. So we already know that there are 4 ways to submit our claim form, right? So whatever I have explained, the same thing is mentioned here. So this is the COB. That means the patient is having multiple insurances. So in this example, you can see patient is having 3 insurances. So primary, secondary, and tertiary. And accordingly, we have to bill. Every insurance company is having other information. Okay, that information is called as coordination of benefit information. And patient, if patient is taking more than one insurance, then he have to update that information. So here patient has already updated this information at BCBS. This is the insurance name, as you are my primary insurance and after you I have 2 more insurances. Okay, now we should have question like why people are taking multiple insurances, because every insurance plan is not covering everything. There is some terms and condition, there is some limitation. So that's the reason people are taking more than one insurance to cover everything. So as per this plan, 70% is covering and always 30% is the patient responsibility. So to cover this 30%, he has taken one more insurance. Okay, at second insurance also some balance will be there, and to cover that balance he has taken third insurance. Okay, it is not mandatory to take a one two three insurance. Some people don't have insurance, so they are paying from their pocket. But as I said, healthcare services are very expensive in US. So that's the reason, instead of paying the huge bill, it is good to take the healthcare policies and pay the premium. Okay, so that's the reason people are taking. And secondary insurance knows that before them there is a one more insurance, after them one more insurance. So always they are processing like that. If by mistake we directly send to secondary as a primary, they will not process, they will deny. They will deny as before them there is another insurance. So they need a primary EOB. Okay, primary receipt, explanation of benefit. They want to know that how much process and paid by primary, and then only they will process and pay. And tertiary insurance always need primary and secondary EOB. Okay, so again in terminologies we'll cover this, don't worry. Okay, so we were talking about the claim submission. We already covered in our first session. There are four ways to submit our claim form. Electronic is the preferred way. Second is the paper, fax, and web portal. So first of all, we'll try to understand about the electronic in detail, because 90% claims we are sending through electronically, and we already knows that how we are sending. So electronic payer ID is needed to submit our claim form through electronically. Okay, so so consider that this is our software, practice management software we are using here. Any practice management. So many practice management softwares are there in the market now. Okay, so we are using this, and we are sending our claim form to patient insurance. So example, this is the UHC insurance. Okay, okay. So now first we have filled the claim form and we have submitted. It is reached to the claims department at UHC, and they have taken some standard time frame to process the claim, like 3 to 15 days they used to take. Every insurance company is having some time frame to process the claim. So patient came today, he has taken service today, and some coding, eligibility verification, whatever we are taking time to submit the claim, consider that we have taken 1 week to submit our claim form. After that, after 1 week we submitted the claim form directly to the insurance. ESC also has taken 2 weeks to process the claim, and after processing the claim, they come to know that some information is missing on the claim form. So what they will do? They will deny. They will deny the claim, said that some missing information. Again, what we'll do? Again, we will update that information, and again we will resubmit our claim form. Right? Again, we will resubmit. One second. Hello. Yeah, I'm sorry, guys. So we were talking about uh, how the insurance company is receiving our claim. So second time also we updated according to the denial and we submitted our claim. Second time also they have taken 2 weeks, and they denied our claim that some information on the claim form is wrong. Okay, so again we receive a denial. Okay, these are the very silly things that due to this we are not receiving a payment, and it is taking too much time to receive the payment. Okay, due to the small mistakes. So actually in live world, we are not directly sending claim form from our application or the software to the insurance. Okay. So there is a third party software everyone is using, that is the clearing house. It is called as clearing house. We are taking service from the clearing house application. Whatever practice management software we are using, we are sending our claim form to that EDI or the clearing house software. Okay, and this clearing house software is checking the format for claim form, everything is correct or not, all the required information is there or not, and then only the claim will go to the next level, or else that claim will stuck into the clearing house. That is called as internal rejection. And checking this in required information or the format for the information, this process is called as scrubbing process. So clearing house is doing scrubbing for our claim, and if any missing information, required information, format is wrong, then that claim will stuck into the clearing house, it will not go to the insurance. And a dedicated team will be there, to handle or to work on those denials. Okay, one second. Recording. Sorry guys. Okay, so dedicated team will be there to work on a rejected claim, and they are working on two kind of rejections. One is the internal rejection, that we have submitted our claim to the EDI and internally rejected by our clearing house. If claim pass by our clearing house and going to the insurance, so insurance also don't want to accept wrong claim, so they are also taking service from one of the clearing house. And they are we don't know what kind of clearing house they are using, but they want a filtered claim. That means they also have set some rule in the clearing house, and if everything is correct, then only it will reach to the claims department. Okay, so if anything is wrong on the claim form as per the insurance clearing house, then it will reject from the insurance clearing house. That is the external rejection. So internal rejection, external rejection. On both the rejections, our dedicated team will work, and they will fix those things, and they will again rebuild from the clearing house itself. So consider that first time we build our claim from our practice management software, and policy ID is missing on the claim form. That is the mandatory information, but it is not on the claim form. Why it is not on the claim form? Because in our software, on the date of service level, policy ID is not updated. That's the reason on the claim form it is not uh, going. Okay, and claim is reached to the EDI, our EDI, and it is stuck. That means it is rejected for the policy ID is missing on the claim form. So dedicated team is there, they have turnaround time 1 to 3 days. So within a 1 to 3 days, they will work on each and every rejection. So they will update that policy ID. They have two options: either they can go to the practice management software, update there and resubmit from practice management, or else they can update in clearinghouse itself and they can push the claim from clearinghouse. Okay, so if they are submitting from the practice management software, so the rejected claim they will delete. Okay, because one more claim, again the same claim will come from the practice management software to the EDI. Okay, so the decision is in their hand whether they want to submit again from the practice management software or from the EDI itself. Mostly they used to submit from the EDI. Okay, and also they are going to the practice management software and updating the ID, so that next time such kind of claim will not come to the EDI without policy ID. So this is only the example. Okay, and the claim will go to the insurance clearing house. It will also check the everything, and then it will reach to the claims department. Okay, so this is the process of sending or submitting our claim form to the insurance claim department. Once they process the claim, they are sending us a EOB. So as I said, electronic version of EOB is called as ERA. So that ERA is coming to our clearinghouse or the EDI software. Okay, so and our application is synced that means integrated with the EDI software. So payment posting team is there. Their task is to enter all the entries according to the EOB. Okay, but there is a one rule for them. From the client side, they should get a green signal whether they have to post that into the account or not. If example we receive EOB in or the ERA in our clearinghouse and it is showing that $5,000 has been paid, but really that 5,000 has been created into the credited into the account or not, who will confirm that? From the client side, they will confirm and they will mark those ERA into the clearinghouse that ready for uh, posting. So within a one click, if 30 or 300 patients accounts are there under the same ERA, in 1 or 2 minutes only, automatically it will get posted into the particular patient's account. Okay, that is for the ERA. If we are receiving paper EOB, that is the manual work, one by one they have to go inside and they have to post. Okay, it will take too much time. But for the ERA, it will get automatically posted into the patient account. Okay, if it is any denial also, it will posted into the denial, patient responsibility, payment, everything on the basis of EOB, it will get posted into the patient account. So at least I hope you guys understood how the electronic claim is going to the insurance and how we are receiving ERA from the insurance. Okay, so at this point just remember only this thing. Okay, we'll discuss again the other part like paper, fax, okay, other options. But 90% claims are going through electronically only. Okay, so next department we'll see again RCM cycle. Okay, so here we are. The claim rejection is nothing but the EDI department, and payment posting we already covered. Their task is to post the payment, and on the basis of EOB, if any denial, payment, patient responsibility, everything they will post. Okay, and also if patient has paid any amount initially or later, that also they are going to post. Okay, so next is the secondary claim submission. So as I said, patient can take second insurance, tertiary insurance to cover their balances. So if we receive a payment from primary insurance and if there is any balance, so for that balance, if patient is having secondary insurance and it is active and it is covering giving the benefits of those services, then we have to submit to the next insurance. So in some software, there is a automatically it will go to the secondary. In some software, we have to manually submit to the secondary. So as a AR, we used to work on only those claims where balance is there. So if in analysis you found that there is a balance and we already receive payment from primary and patient is having secondary insurance, then we are only responsible to submit that claim to the secondary insurance, but you have to check whether it was billed previously to the secondary or not, and then only we have to send it to the secondary. Okay, and next department in the RCM cycle is the denial management. That is where we are standing as a AR. So as a AR we will work on those claims where there is some balance. Okay, maybe we build and there is no response because patient, we have not received any EOB. All the balance billed amount is 2000 and balance amount is also 2000. That is called as no response claim. Okay, maybe we receive a payment and some balance is there. And third is uh, zero balance, so we should not work on zero balance. And fourth is in some account you will see the minus balance, we should not work on minus balance as well. Okay, so what is meant by minus balance? We receive excess payment, extra payment. Okay, by mistake insurance has paid or maybe patient has paid. Okay, so there is another department, refund department, also called as credit balance team. They used to work on those minus balances. Okay, so we can skip those accounts which are zero and minus. We just have to focus, and in after 6 month experience, you will be able to understand about the minus balances also. You can find out why balance is minus and all. It will take too much little bit time to understand those accounts. Okay, but at this point no need to worry about those things. you can just remember zero and minus balance we can skip, and we can work only on those accounts where balance is there. Okay. And so many denials are there, more than 50, 60 denials are there, we can say more than 100 denials are there. But from that top 20 denials we will cover in our sessions. And in interview also, from those denials only they will ask you. In our daily work also, if your target is 35 claims, almost 30 to 33 claims are from those 20 denials only. Very other rare denials are there. Anywhere, if you are not able to understand the denial, simply call to the insurance and ask more detail about the denial, and accordingly you can take the action. Okay, so denial management, anyhow, we are having almost 2 week session on this. Okay, we'll focus more and more to understand about the denials. Okay, this is very important uh, to become a AR. Okay, next is the medical appeal. Sometime we are only responsible to send create the appeal. So what is mean by appeal? So appeal is nothing but it is the last option for the denial. Okay, it is the written document we are trying to convince to the insurance why we should get a payment. Okay, insurance has denied for some reason. Okay, and we are having some related documents or the medical record. So in such cases we have to fill the insurance for that particular insurance. They are having a appeal form, we have to fill that and attach the respective document what exactly we have to send them. Okay, and then we have to submit that on their given fax number or the address, or on their web portal we can upload. For the appeal you will get a training. Whenever you are joining in any company, you can tell them that uh, I'm not aware about the appeal process, because if first time you are doing the appeal as a AR, it will take time, because you are not aware to which website you have to go, what form you have to download, what kind of information you have to fill, what documents you have to attach, where we have to send. So that's the reason in 90% companies they have dedicated person in the team who used to do the appeal for all the teammates, because this is the last option to get the payment. Okay, we already receive multiple times denial, we already try to resubmit or by doing some corrections, and after that also we are not getting payment. So in some cases we used to send the appeal, and if we are sending wrong appeal, after that definitely will not get a payment. So nobody want to take a risk in the appeal. So that's the reason experienced people who already know everything about the appeal, so such kind of dedicated person will be there in every team, and who used to do a appeal for everyone in the team. It's a time consuming. If as a fresher or any new person is creating appeal, it will take 15 to 20 minutes. But this person who is frequently doing appeal every day, he can do it in 5 to 7 minutes. Okay, and at last, in RCM cycle we are having credit balance team. It is also called as refund department. So in case we receive a excess payment or extra payment from insurance or patient, so in that case this department will analyze and identify from where we receive the excess payment, and actually they used to do the transaction and they are refunding that amount to the patient or the insurance. So example, patient came and before taking the service he knows that as per his plan there will be some patient responsibility, so he has paid $1,000. Okay, we submitted our claim form to his insurance and we receive some payment, and as per the EOB patient responsibility is only 300, not the 1,000, but he paid 1,000, right? So that $700 we should refund him. Okay, so this refund department is doing that. Those minus accounts are nothing but uh, the excess amount. Okay, and sometimes insurance also paying in wrong. Sometimes they paid twice by mistake. Okay, so multiple incidences can be happen. They want to pay as a secondary, but they by mistake they paid as a primary. They want to pay only $100, but they by mistake they paid $200. Okay, so like this, and they used to send us a refund request later also. So this refund department or the credit balance team, they are analyzing everything, and after confirmation only they used to refund that amount. Okay, so this is about the refund department. And this RCM cycle, if somebody ask you explain the RCM cycle sequence, we should not miss the sequence. You have to describe in this sequence only. Okay, at least minimum two line anybody can speak. Okay, we already know that patient appointment what they are doing, eligibility and benefits team what they are doing, okay, authorization department what they are doing. So only you just have to explain these department what exactly they are doing. Okay, and in this sequence if you are telling at least 10 to 12 minutes it will take to explain. Okay, and if you are explaining very well, hardly two or three questions they will ask you in the interview if you are perfectly answering for this. Okay, you can explain in your word, you don't have to mug up anything from the notes. Okay, so it is in the notes as also whatever I have explained, everything is written in my words only. Okay, so you can go through this, and if you are having any question on any topic, then or any department, then you can ask me. Okay, I'll explain you in another ways, but this is very important. Okay, at least you should know how the claim is going, which department is what kind of information they are entering into the software. You are not responsible, you are not the single person responsible for everything. You are only responsible for those claims where balance is there or the denials are there. Okay, so that's it about the RCM cycle. Anybody is having any question, guys, I can answer, and then we'll go for the next topic. Yes, yes, no, you can unmute, guys.
Yes.
Nobody has any question. Sumit,
No,
Sagar,
sir.
you guys understood. Don't hesitate,
Yes.
don't think about other guys. You you only need the job, right? So don't think about other
Yes.
people. Okay.
Sir, if the interviewer asks about the explain the RCM cycle, then we have to explain in this way, like you wrote on the PPT. We have to understand that things and
You can summarize. You can,
explain by.
yeah, you can
Yeah, yeah.
create a summarize. You can write in your word. Okay, as a
Own,
practice you can
own,
do that. Yeah,
own. Yeah. Okay. Okay.
because it is very hard to speak each and every point in the answer in the
Yeah,
interview,
is
right?
it very difficult to mug up and to explain the interview? So that's why it will be difficult. So the best way to write in our own language, sorry, own words, and we will try to explain in that way.
Yes, as I said, only one or two lines you have to write each and every
Yeah.
department. Okay, and explain more about the denial management that they are
Okay.
expecting because you are working in the denial management. Other department just explain in one line, that is enough. Okay, they just want to know that how much you know about the other department.
Okay. Okay. Yes.
Any other question, guys?
No, sir.
Okay. Mm, So the same thing is there in our notes. I'm going to share you the notes only. Okay, not these PPTs. Okay, so one more topic we will discuss today, that is the as a AR, what all are the responsibilities? Okay, interviewer can ask you as per your role what exactly you are doing on a daily basis. So we have to check the claim status. If there is no EOB and there is no uh, claim status received from the insurance, then we are only responsible to check the claim status, and multiple ways are there to check the claim status. You don't have to call every time. Okay, every insurance company, they are having their web portal. We just have to log in and enter the policy ID. Okay, and then we can check the claim status. Okay, I'll share you some recordings and you will get some idea. Okay, and it is very easy, guys. Any insurance company, you just have to go to their web portal and log in and go to the claims tab and enter the policy ID and the date of service, and you will get the EOB. It is so simple. If you are not aware about a particular insurance and you are on the call with the representative, you can ask them, they will help you to navigate where to go and how to check the claim status. I have also taken many time help from the representative because I was not aware about their websites. Okay, so if you are aware to check the web portal for at least one or two, easily we can check a claim status on any insurance. Okay, it is very easy. Other thing is to check the EDI. So many times if we are checking that we have not received any response from the insurance, might be possible claim has been rejected. So in that case, if claim was billed through electronically, you can check into the EDI software, also called as clearinghouse, whether claim has been accepted, rejected. Okay, the history you can check. Okay. Next is to work on denial. That is the important. Might be possible whole claim has been denied. Might be possible only one or two procedure code denied for some reason. So on the basis of denial, we have to take the action. Okay. Example, one procedure code has been denied for some coding related issue. So you have to write those things and you have to forward that to the coding team. You don't have to call anybody. Okay. Directly you can send to the coding team. You will get one count for that. Okay. So like this, we have so many scenarios. We'll discuss that in our denials. Next is the request the copy of EOB. This is also our responsibility. You call to the insurance for claim status and you come to know that they process and paid. But we don't have EOB. So you have to request the EOB on our fax number. Okay. Next is send the medical record. Sometimes you come to know that claim is in pending status. They are waiting. They need the some medical record from our side. So you are only responsible to send the medical record. So you have to ask them where we have to send the medical record and you have to take that action. Okay. Next is forwarding to coding team. Just we spoke. And send appeal. If dedicated person is not there in the team, then you are only responsible to send the appeal. So we'll discuss this again in our denials. What kind of appeals and what kind of documents we have to submit and all. Next is to check the eligibility of policy. So example, you found that we already received payment from primary and there is a secondary insurance, and for balance amount you want it to submit to the secondary, but blindly we should not send to the secondary. First of all, you have to check whether that plan is active or not and what kind of benefit it is giving. If secondary plan is dental and these services are not related to dental, there is no meaning to submit our claim form to the dental plan as a secondary. Okay, so that's the reason we have to check whether that plan active or not. If it is already terminated, then also we should not send our claim to the that insurance. So before sending our claim to any insurance, we have to make sure that that insurance is active and it is the benefit are there. The services are getting covered into the policy. Okay, what kind of plan it is, you have to check. Rebilling claim to primary. Okay, by mistake we billed to the wrong insurance as a primary. So you have to change the sequence on date of service. Okay, after checking eligibility, and I'll tell you how to analyze the account, how to find out which one is the correct insurance and all. We'll discuss again. Okay, so you have to rebill it to the correct insurance as a primary. Okay, and if we receive any denial, example coding related denial, you already forwarded to the coding and coding has already responded. So you have to update accordingly, and second time if you are sending claim, that time you have to submit as a corrected claim because we did some correction on the claim. Okay, so I'll tell you how to submit the corrected claim and all. Don't worry. Rebilling claim to next payer for balance amount, we already discussed. And billing to the patient. If there is any patient responsibility and patient don't have any other insurance, then we have to bill to the patient. But always remember, before billing to patient, there are two more insurances. We have to check eligibility with them. That is the Medicare and Medicaid. Those are the government insurances, and just for safer side we have to check whether patient is having that Medicare or Medicaid. If not, definitely we can bill to patient. Okay, so these are the responsibilities as a AR on daily basis. We are doing this. If anybody is asking you in interview, then definitely you can cover this. Okay, as much as possible. It too I have in almost 10 plus points I have written here. So at least try to tell them at least 5 to 7 points. Okay. So the same thing in the notes what we covered today under the second session. Okay, and we have next session on the CMS 1500 form. That is very important because every day for doing 35 claims, at least for 30 times we are not 30 times, at least minimum 20 times we are opening the claim form, and we should know the important boxes in the claim form. Okay, so we'll try to understand in detail about the claim form. Okay, so go through the notes for the RCM cycle and create your summary. Okay, what if somebody asks you in the interview, explain the RCM cycle, what exactly you will speak in the interview? Like that, you can create and you can write like how we are writing. Tell me about yourself. If somebody is asking you, tell me about yourself. Most of us has written many times. Okay, in past, what exactly I have to speak in the interview. If somebody asks me, tell me about yourself. Same thing here also you can do. If somebody is asking you, explain the RCM cycle, you can summarize, okay, in your words. Okay, at least that person can understand what exactly you want to tell them. And in notes also, I have written only in one line. Okay, use this in short and create your own answer. Okay, so after 2 3 days we'll start internal mock-up practice. So in that also you can ask these questions to each other and try to improve in your answers. Okay, so I'll stop recording here and then again we'll discuss. 1 second.